For many of us, the concept of health is defined as absence of disease. But do you really believe that to be true? As a specialist surgeon and teacher, I have come to the firm belief that true health is a balanced state between the mind, the body, and the soul. Under the Knife with Dr. Arun is an attempt to tap into the wisdom of world experts from various fields to learn practical tools that can allow us to change our own destiny. Not just in the field of health and wellness, rather in every facet of a fulfilled life. But it begins with health. Because as Emerson said, health is our first wealth, the value of which is only recognized when it is lost. Join me in welcoming another global expert in this episode as we explore some amazing self-empowering ideas today. Hello everybody, welcome to another episode of Under the Knife with Dr. Arun. Today I have a very special guest and a senior colleague of mine, Dr. Dalal Akhoury. I'm so honored to have Dr. Dalal on this show. I want to read out a little bit about what this amazing person is doing in the part of the world where she lives and is actually influencing by her energy, not just her knowledge, but her energy on how we can transition to a state of peak and optimal health and wellness. I met Dr. Dalal through a common friend, and right from the first meeting, we really connected very well. Dr. Dalal is an MD and is an advanced integrative medicine authority, practicing family physician, and internationally recognized leader, speaker, healthcare educator, and an advocate in the field of functional and integrative medicine. Dr. Akhoury has dedicated her career in identifying and addressing the root cause of chronic illnesses through a groundbreaking whole system medicine approach known as functional, integrative, sexual, cellular, and metabolic medicine. That sounds really exciting, and I can already see that we are going to have tons of questions. But what I love about you, Dr. Dalal, is your mission. Your mission is to actually empower your patients so that they can enjoy that sparkle of true health and wellness without just relying on pills and procedures all the time. You help people unlock their innate healing abilities. And that's what I love about the work that you're doing. You're doing it in a very evidence-based manner. And I am so excited to get into a conversation with you. Please allow me to welcome Dr. Dalal Akhoury. Thank you, Dr. Dalal, for this time that you've spared for me. And is there something I want to get into? What got you to where you are today? Give me a little bit of an overview. I know you came from Egypt and that's where you started from, but I need to know, what was your background? What motivated you? And I know you're a pediatrician by training.
So Dr. Arun, I am, number one, want to tell you, I'm very honored. I'm very blessed. I'm very happy and excited to work with you today and collaborate to transform the world together and make healthcare a new gift for everyone around us. So I'm really excited about that.
Thank you.
So why do I do what I do, and who am I? Well, I am originally from Egypt. I was born to an upper middle class family. My dad was my role model. I wanted to be like him. He was an engineer. I adored him. And you know, when I became 15, my dad developed pancreatic cancer. And that was a turning point in my life. It may not be as traumatic as other people experience, but that was my turning point. So when he died, when that very strong, powerful man who was so well recognized worldwide developed cancer and became feeble and weak and yellow. And at that time, they wouldn't even tell us what the problem was. Back then, they wouldn't tell you, even though they knew he had pancreatic cancer. It was not the customary to really inform the family, especially not the children. So I didn't know what's happening to my father, except that I knew that my father is not the same. He turned yellow initially without his hepatitis, and then it turned out to be really, he's losing weight, he's feeble, he's weak, and eventually we knew he had pancreatic cancer. But I lost my dad when I was 17. I was the oldest of four, and it was really a trauma for me. It was really the point that changed me. It was a turning point for my initial life. I was the oldest of four, and I wanted to really be a leader to help my family, my brothers and sisters, my brother and my two sisters. So I changed my decision of being an engineer like my father. Now I want to be a doctor because of my father. So I became a doctor, and I fought a whole lot. I got married in Egypt, and I still did not want to leave the concept of being able to find answers or cure for cancer. At the time, I thought I was looking for cures, but then I discovered I was looking for answers for cancer. Because I don't believe there's cure for anything. I just think it's lifestyle things, choices that we make. So I left my two boys in Egypt. My oldest was only 2.5 years old, and my youngest was less than a year old. I left them in Egypt right after I graduated from medical school, took my American boards exam, which was at the time ECFMG didn't work. I did the VQE, whatever I had to do, I did. I left my kids with my husband, who was an anesthesiologist, did not see them for a year and a half. Now that was more painful, way more painful than even losing my dad, whom I adored. But I was driven by my mission to the point that I would not change anything if I were to start over again.
So is it fair to say, Dr. Dalal, over there, that you kind of found your calling at that point in time, at that age of 15, and then you just pursued it?
I think I found my calling, but I also learned to appreciate cancer. I also learned to understand that my dad's, one of his missions, he had lots of missions, he'd done lots of great things, but one of his missions was to form me, the person to be. So I had to have that trauma that was very painful to really change me to be the person I am today. So yes, it was my calling, but I believe that my dad was instrumental for me to find my calling. So I think I started appreciating cancer in a different way, since when I saw that cancer can be a teacher, cancer can be a leader, cancer can be a transformer. So I started really also developing a relationship with cancer. And I think that helped me help many patients, is a relationship of not an enemy that I want to kill, but someone that is giving me a message and I'm trying to really respond to the message. So I changed the energy between killing cancer into taming cancer, because I feel like the killing process really, it's not helpful. And I think, if we can do, if we induce really, regression in a better way, or if we consider cancer as a prodigal son and help the prodigal son to really, because if you really look at cancer, really, you really know that cancer is like a prodigal son. Let me explain that in a different way. Is a cell that has not been committed to any lineage. So it's a very young cell. The more uncommitted the cell is, the more immature the cell is, the more aggressive the cancer is.
And so it goes out of control.
That is keeping all the DNA and all the genetic code and is not committing to a lineage. Once the cell commits to a lineage, the cell can get into, cell death. So we're not programmed cell death is not even in the equation if we are in a stem cell level, which is really retaining all the nuclear DNA material. So that taught me that, taming cancer and helping cancer to really mature into healing stages, or to mature by restoring the microenvironment or understanding. And so it was a journey. It was a journey. So
I feel I'm inspired to ask you a question there. Sorry to interrupt. I really love the analogy that you mentioned about, how to not kill cancer or fight cancer, because these days there are so many missions going on. Fight breast cancer, fight ovarian cancer. But you're so true in saying that you can't create peace by fueling fight. So you have to tame. And I remember what Mother Teresa said when it was the Vietnam War time. People asked her, let's go, we want you to come for the anti-war rally. And she said, no, if you have a peace rally, call me, I'll come for it. but I won't go for an anti-war rally. And that's the same concept that you are saying. So I really resonate with that. But here's a question, Dr. Dalal, that I often I have experienced it personally, and I hear it from my patients time to time. Why is it that human beings learn more in adversity than they learn in a time when everything is nice and comfortable and all of that? Uh, do you understand my question?
Absolutely. I
Like,
mean,
why do we learn more? Why does adversity have, like it happened for you? You lost your dad, and that was a shifting point for you. There was an adversity, and you shifted.
well, I believe, it's my belief system, and I really believe it's really true, but it's probably evidence-based as well. We are made to come on the planet to survive. And that's why we have the limbic system. That's why we have the primitive brain or reptile brain. That has survival mechanisms. And it really helps us to keep it. If we use that properly, we have enough sharpness to really upregulate the good genes that keeps us going into the fight mode. But when we become totally sympathetic dominant, and really we all talk about adrenal fatigue, but we don't address the fact that really this autonomia is what's really happening. I'm a more sympathetic dominant instead of really being parasympathetic. We don't have a sympathetic parasympathetic balance.
Correct.
So that creates really takes off the balance, allostatic balance. So we come to a stage we are really surpassing surpassing the total load, So homeostasis
Homeostasis, correct. Yeah.
is totally interrupted.
Yes.
So when we have an allostatic load that is too huge because of the sympathetic tone. Now, a sympathetic tone is essential because it keeps us sharp. It wakes us up.
We need that eustress.
You need that sharpness. You need that power of being awake, alert,
and driven as well.
And driven as well. And that's what the dopamine receptors are for.
Yeah.
They keep us driven, they keep us motivated, they keep us wanting to, but it's all under that influence of survivorship. So once we are really complacent and do nothing, I mean, there's no need for anything. You don't have survival skills. You don't have to turn the genes. Did you know that 25% of the genome is under the influence of just cortisol?
Wow.
25% of the genome. Which is really 1/4 of the genes we have are influenced by just one hormone, cortisol.
Wow.
Imagine.
That's the stress hormone, of course, and that's clearly. So that brings me to this question, Dr. Dalal. How do you tell a person who, say somebody's listening to this and they have had a new diagnosis of a mass in their breast, a lump in the breast or a mass in the liver, and they're worrying about this being whether this is a cancer, and you are telling that stress can cause disease. Now, how do you tame such a person? Firstly, you have to tame the mind before you can tame the actual disease, right? So when such a person comes to you, what do you say to them? They have come to you with a CT scan or imaging saying that, look, this is the mass, biopsy is showing it's a cancer. Tell me, Dr. Dalal, what do I do? So how do you approach them?
The problem that most people don't do anymore, and what I still elect to do. I mean, at any age, I'm still practicing medicine. And when I do practice medicine, even at my age, I don't know if I should tell you my age. I'm over 67.
Oh, you look so young. So, please.
I like people to know that, by the way. I like them to know that.
My dad told me never ask a lady's age and a man's wage.
I love that. But, I like people to know my age, because if I preach that I do, optimizing aging or helping people to age properly, and if I don't look it, why would you believe me? Why would you trust me? Why would you follow me?
Correct.
Why would you believe what I tell you?
Oh, we have to live the talk and
I
talk.
mean, if I don't live my talk, why would you trust me?
Absolutely.
So for me, that was really essential for me. But your question was, how do I approach that? So I still do the traditional way. I listen. I listen and I really tune in. And the word tune in, I do. Like I sit as close to my patient as I possibly can. I get in their face, and sometimes I try to see that without invading their privacy or without invading that area, how much can they let me in? I listen to nothing else. I hear no one else. I'm focused on nothing but them. And I keep digging and digging and digging. And it's really weird, but I dig until I found that emotional spot that caused the cancer even 15 years prior to the initial thing. And many times I've seen myself been able to put people to cry from the first visit. And I really had no intention to make them cry.
No. But it's the emotion coming out, really, isn't it?
Yes. So when I tune in enough, and I'm able to figure out that this could have been one of the reasons, and most of it is going to be guilt, most of it is going to be shame, and most of it is going to be bitterness or stress or hatred. And is it really true?
So these are suppressed emotions which trigger the stress response, which actually brings me to the question that you asked me, or you mentioned just now, is that, 25% of your genome is being triggered by cortisol alone, which is fascinating. And I didn't know that, but I truly believe
it is really crazy. I mean,
yes. But I truly also believe that there is this power in epigenetics, which is your environment, the whole science on environment. And so many people, I get to meet them, like, as you know, I deal with predominantly obesity surgery. I deal with upper GI cancers. That's the area of my specialization as a surgeon. And I hear people say time and time again, I'm overweight because of my genes. Because my mom and dad were diabetic, I'm going to be diabetic. My grandfather had heart disease, I'm going to have it. So how do you approach that, Dr. Dalal? Because there is this vacuum or this lack of knowledge as far as we think we are committed to a disease if our parents have got it.
Well, here's what I tell my patients. And there is a group of people on Clubhouse who talk about genetic, and there's a lot of genetic testing. And I really do some of it, but I don't believe that it has to be, an essential part of all the treatment. And it's good to have, but I tell my patients, genes are never your destiny. But the genes, it's good to know which genes are having, any abnormalities, or a SNP of some sort. It's good to know that.
Yes.
Really, the genes are on by the epigenome. So the epigenome is really more important than the genome. The genome is very important. It's just so it's the blueprint. We don't have to transcribe that blueprint into action and protein that is functional ever, unless we turn it on. So that's why cortisol affects everything. So when you turn on, when you need stress, when you're under stress, you need to turn on some particular genes, but probably especially the GLUT1 and GLUT4 that are really involved in the most of the problem we have. So that leads to insulin resistance. That leads to increased glucose dumping in the body. So whether you eat the regular diet or hyperglycemic diet or not, if you're under stress, you're hyperglycemic.
Anyways,
on the GLUT1 and GLUT4, and it's all under cortisol, so you are turning on the genes, which really means you're transcribing the gene. So these genes now are upregulated. And then if you need them, the more you need them, the more you upregulate them. And then you create a dysfunction. And then most people don't realize that we have an energy source that is really, it's limited. It's not an unlimited energy source.
Correct.
So if we use all the energy to transcribe the genes that are destructive genes, or the fight and flight response gene, not the restorative genes, not the
or
not
disease-producing genes.
genes.
Yeah.
So you are really creating a disparity of energy. So you're really taxing your mitochondria. Okay.
Yeah.
So now,
which is your powerhouse.
Right. So once you have cortisol up, you also influence the mitochondrial genes, because even though the mitochondrial genes are only coming from the mothers, they're not shared by the father. You still have that cortisol even affect the transcription of those genes.
Yeah.
So you turn into a big energy deficiency, and then your gas prices go up.
That's true, as we are seeing right now. and actually, I say this, that, you can either have energy to heal, or you can have energy to sustain that state of disease. There's only a finite amount of energy.
Right.
You don't have indefinite energy. Exactly.
This is exactly what you both and I are saying. It's just that it's not an infinite amount of energy. We have a limited budget.
Yes.
And we have to continuously renew. You renew only when you sleep.
Yeah.
So you're not renewing your energy sources, but you're depleting the energy sources.
Yeah.
So what would you expect?
And I remember once reading of, and I still remember this, and I share this with my patients whenever, a cancer patient would come to me, and if they had metastatic cancer that was spread all over the body, they would say that, I've been given 3 months to live. I've been given 6 months to live. And I would say the same thing to them: accept the diagnosis, not the prognosis. You can change things. Yes, it is harder if things have spread all over the body, but the body has amazing healing abilities. And I know with your work in the International Organization of Integrative Cancer Physicians, of which you are a board member, I am aware that there have been so many remissions, cancer remissions, that are being now studied by PhD and doctorate students. And there is evidence, actually evidence. It's not like a miracle story that you hear once in a decade or so. So I truly believe that. But I want to ask you something on an area that I'm truly passionate about: is how does stress affect our gut microbiome? Because I know you've done a lot of work in that space, and gut health, and that's an area of my work as well. So please share with me, how does stress affect our microbiome?
Well, stress does not affect only the gut microbiome, but it affects every microbiome in the body. Right. So it affects the skin microbiome, it affects the vagina's microbiome, it affects the oral system microbiome, the eyes. All the microbiome is totally affected with stress. Well, what happens when you are under stress? Well, what happens is we're creating a relative ischemia to certain areas, okay? So we're creating relative ischemias to, the bowel, relative ischemia of the skin.
Correct.
In order for us to spare that blood flow to the heart and to the brain. Yes. So while we're doing that, we're creating an environment that is not hospitable for anything. Not only the mucous membrane and the cells and the brush borders, but also it affects the nutrition for the microbiome. So you really are changing and shifting the microenvironment for the microbiome. And the microbiome also becomes stressed. Yes. So the microbiome is going to turn on genes that are making it more aggressive and behave in a more than being a good flora and a symbiotic way into a more aggressive way, so that it protects itself. So it starts like you have a possum, and you have the whatever that.
You're talking about the lactobacillus, the bacteria?
No, I'm talking about if you hit or you get a skunk upset, it releases toxins, right?
Oh, yes.
It releases very dangerous poisons. Okay? So the microbiome under stringent conditions, they're not happy.
Yeah.
And they become more invasive instead of being part of the symbiosis and work together. That's one thing. Second, you change your pH of these.
Yes.
So you're changing the nutrients that are in the nurturing system for that.
Yeah.
It becomes not hospitable for good bacteria. It really only wants bad, angry, unhappy bacteria. So you are changing the microbiome by all the stress hormones, by also inducing more inflammation.
Correct.
And inducing more cytokines, including more, you start creating bacterial overgrowth because your gut now is not even working properly. So you're not digesting your system. So your gut flora changes into becoming your digestive system. So they start fermenting and you change your acidity. So it's a lot of reasons why, and more stress or sugar in the body. So you have more candida.
Yeah.
And low level bacteria or low frequency bacteria.
Yeah.
Attract more low frequency bacteria. They live together. They like
Correct.
that.
Birds of a feather flock together. Exactly. Yeah. And I think I mentioned this in my book as well, that your oral cavity is the window to your gut health. And people who have got a lot of dental issues, dental caries, have had to have significant root canal treatments and all of that. Exactly.
Yeah.
And
root canal treatments we're having dead
gingivitis, the gum disease. Correct. And that leads to it's associated with fatty liver, diabetes, and your risk of getting a stroke. But what is more important is my dentist has changed their practice. They check our oral pH now. As you said about pH, body needs alkaline pH for a healthy microbiome. And if we are stressed or we are leaning more towards sugar, it turns acidic. And I think that's what is the breeding ground for disease. But Dr. Dalal, that's a really fascinating sort of, way how you're approaching it. I'm really curious to talk to you about your, groundbreaking whole health system, which I think there are some elements that I'm really curious to know about. And maybe there are some things that I would like to touch upon in a very professional manner, because it's what you are addressing is concepts around, as I can see over here that you mentioned, functional, integrative, sexual, cellular, and metabolic medicine. So can you give us a bit of an overview of what the program is like?
I don't know if you want to talk about my personal program or in general how I see health, because I'm franchising AwareMed right now. Right. And we're going to be training people. I'd love to really work with you on training more physicians and more healthcare practitioners to really practice really a good transformational medicine that is evidence-based, but still whole person.
Yes. Yeah, so I would love to know an overview.
Approach medicine. So really, we're nothing but everything together. If you slice me and say, I'm the gastroenterologist, I really work on this area, okay? And then, no, I'm not, I'm the cardiologist, I work on this area. And then the cardiologist that does not even know what the gastroenterologist is doing. And you're slicing that body into everything. And the cause of everything is maybe cortisol.
Yeah.
Or the cause of everything is overexpression, of genes that should not have been expressed, but we made the wrong choice and we overexpressed the gene that should not have been expressed. You could have BRCA positive, but you don't have to have cancer. Unless you have turned on the gene. If you didn't express the gene, if you did not take an environment, make a decision, like if this was whiskey, for example, instead of water, then what are you doing? What destruction? So every choice we make, whether we smile, whether we laugh, whether we are angry, whether we're with the wrong people, whether we eat the wrong food, those are choices. But we don't know the consequences of those choices. And a lot of time, we don't know that every single thing I do, which you mentioned earlier is an epigenetic, is turn a specific gene, which we call gene expression.
Yeah.
So the gene expression is directly under the influence of your choice. The choice could be internal choice or external choice. Internal choices will be pain. If I have pain, that's a stressor that really induces the same thing. but it's an internal environmental thing.
Yeah. I often
And
say on the question of choice that your life is a direct reflection of the quality of choices that you have made. Every
right.
choice is either healing you or hurting you. So you're absolutely spot on, Dr. Dalal.
So what we need is really to help people understand
Mm,
your genes are not your destiny. Your
yeah,
genes are not your destiny.
that's so true.
They're not.
They're not. Yeah.
But your choices, which is what we call epigenetics,
Mm,
your choices are your destiny. Because you could have the BRCA positive gene, but if
yes,
it's not expressed, it's not going to make any difference.
correct.
So knowing that you have that BRCA positive gene may
Mm,
make you nervous all your life and
yeah,
make you decide to do bilateral mastectomy. And
yeah.
after bilateral mastectomy, you still can develop breast cancer. All right?
Really?
Yes.
In the
So
residual breast tissue.
yeah,
Yeah,
you
that's
do
true. So,
preventive medicine by saying, I'm going to do bilateral mastectomy.
yeah.
But if you express the gene, that doesn't mean anything. You're
And if
already
you're
going to.
still stressed out, you could develop a cancer somewhere else.
Exactly.
Yeah, yeah. So tell us about just an overview of this program. Like, how do you approach these different areas? Like, just a brief overview. And I then want to delve into this sort of topic, which is kind of like a taboo in our society about sexual health. Nobody wants to talk about it. So I want to delve into that just a little bit to see whether there is any association between your libido. I'm not talking in terms of addiction. I get that. I get that it's an addiction for some people, but I'm talking about can a healthy libido create your health and well-being? So,
Absolutely healthy libido is essential for living healthy, or
right.
we wouldn't be. So once you're okay, the problem about sex really is we have vilified sex.
Hmm.
Sex is a gift. Actually, what happens after a good relationship and a sexual or intimacy relationship? A miracle happens.
Hmm.
A baby is born. I mean, new
Yes.
life is born. So really, sexuality is not a bad thing. Everything is based on healthy sexuality or sexuality. If we're really going to say sexuality is bad, we won't have, I'm not pro meat producing, but what if we stop that process? Say, okay, we segregate sex. So sex is part of the miracles of life. It's a miracle.
Hmm.
Out of nothing, a beautiful newborn is born. A
Hmm.
beautiful being is miraculously created from nothing
Hmm.
except an ova and a sperm.
Hmm.
How would you think those ova and sperm would ever meet?
Hmm.
They have to have connection.
Yes.
And when would that happen? Not in a fight-flight mode. In a fight-flight mode, when you have cortisol, you have a cortisol steal. It takes
Hmm.
away testosterone. It takes away estrogen. It takes away progesterone. It steals it into the direction of expressing bad genes,
Yeah.
the genes that are helping me fight, boom, boom, fight,
Yes.
instead of miracle.
Excuse
So
my
we need,
ignorance, Dr. Dalal. This may sound like a very silly question, but what about sex when you are not wanting to produce a baby? In
I
this
mean,
era of contraception, how
okay,
does that view towards health and well-being?
well, sex, the peak performance happen for a man or a woman
Mm,
is when they're at the peak performance and when they're sexually optimized for procreation.
right.
Whether we procreate or not, if you optimize the whole environment for
Mm,
procreation, it means those sex hormones help you optimize other hormones,
right.
optimize cellular hormones. Everything, if testosterone was not important, if estrogen was not important, why would every single cell in the body, whether it's a liver cell, a
Mm,
sexual organ cell, or a skin cell, why would they have testosterone receptor and estrogen receptor?
yeah.
Why? If those are not essential, why would you think it's so? Intimacy creates oxytocin.
Correct.
Oxytocin is one of the hormones that are really essential for
For love.
nurturing relationship and for calming people down and
Mm.
anxiety.
Mm.
So we have to really start looking at sex. I'm not saying promiscuity. I'm not
No,
saying,
no, 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 absolutely not. And I get it.
I'm not here to even judge people.
No.
If people have made that choice, if I don't endorse that choice, that does
Mm.
not mean I'm going to condemn the people
Yes.
who make a wrong choice or wrong. Who am I to tell them the choice? I'm here to serve them and help them
Yes.
and make them feel respected, even if they're hypersexual. Because some people are hypersexual and it's a disease state.
Yes.
Some of it, hypersexuality, could be a disease state.
Mm.
Sometimes hypersexuality could be a normal state for some people. And sometimes it becomes an addictive situation where you do the act despite the fact you know the consequences of that fact.
Correct.
So,
and that's pathological, clearly.
I'm sorry?
That's pathological. It is clearly, damaging the being more than it is actually able to serve. So absolutely, I totally agree with that. I'm just talking about a healthy environment. And you've answered that very beautifully. You've answered that why is it, and science is discovering this every day with every research, as you said, about, why are there estrogen receptors in liver cells? What is the role for that? And we can't look at it in
the heart.
Correct, exactly, and the role of oxytocin, which is the nurturing hormone, the loving hormone in there. When the mother feeds the baby, the release of oxytocin is there in both the mother and the baby, which is what creates.
And orgasmically, when people reach orgasm in a healthy state, you really you're excreting oxytocin, and it calms people down and makes people feel better and relax. It's just the remorse that you have around sex and the vilification of a good gift.
Yeah.
That if you looked at sex as a good gift, you would not destroy it. You would be very careful of who you choose because you know it's a gift.
Yeah.
It's a miracle that is going to be revealed, So we need to start looking at sex as a good thing.
Yeah.
We have to really embrace it.
Yeah.
And part of I tell a lot of my cancer patients, have sex. I do.
Right. So you prescribe it?
I do.
Okay, well done. How many times a day or a week or a month do you have like a healthy range for them, or?
For the cancer patients, just intimacy is really important. Yeah. So if their body get closeness, there is true energy being. There is a electrification that is happening. There's the electromagnetic field that is really changing. There's things that are really changing as part of that effect.
And it's more to do also with, the love languages of individuals. Yeah. And for some, just touch, just hugging, just an embrace. That's all that is required. So, and I totally feel this way. Although I don't claim to be an authority, I'm just a student, but I feel it does not have to be, as they say, sex in the bed, Intimacy is more powerful because that has got healing abilities in itself.
It does. I mean, hugging.
Yes.
Skin to skin contact.
Yes.
They change the body. They change. That's epigenetic changes.
Correct.
But if you do them under conditions that you're not comfortable with or uncomfortable with, you all create the other response, which is really the limbic system response.
The stress response,
shame and guilt with it. And we have to remove shame and guilt for most of sexual relationship. If we want people, again, if we give them that this is a gift.
Yeah.
If used properly, a miracle can happen, whether we want that miracle or not, that's our choice.
Yeah.
But if the miracle is happening as a result of that relationship, you're always going to make the right choice.
Yeah. And as you said, it's not about judging anybody on their sexual preferences, on their gender preferences, because I know we live in a society that has got people with multiple preferences. We just have to embrace that. And we have to say, make the best of what you have and be happy and grateful in your skin.
Yeah.
That's the starting point. So, Dr. Dalal, I think this has been a fascinating conversation, and we're coming to the end of it. But I want to actually ask you, can you tell what is your one most successful habit that you have been practicing that has brought to you where you are today? You've been practicing that one habit, just for the sake of our readers so that they can tap into your wisdom. You may have two habits, but we want to know, because I truly believe your habits create your destiny. So please share with us
I don't know
something.
if it's a habit or a trait, but
Please.
I once you never, I never give up. I'm persistent.
Persistence.
And I'm driven by my mission.
Yes.
And really, if there is one thing I'll tell everyone around, find your mission.
Yeah.
I was blessed to have my mission because of the pain.
Yes.
You may find your mission with or without the pain.
Mm.
Look deep enough, love yourself, forgive yourself, and be kind to you.
That's so good. So is there, when I say a habit, I mean, is there anything that you practice? Because a lot of people say, where do I find my calling? Where do I find my mission? Where do I go to? They are looking for it outside somewhere. So is there anything that you do? Because you and I both know your purpose, your mission is hidden inside you, and you have to uncover it. You have to discover it, basically. So is there anything you do on a daily basis? Like, it could be journaling, it could be reading, it could be listening. I don't know. I'm just asking.
One of the habits I've made that I'm really following, I mean, a lot of habits I read and all this, but there's one habit that I want to tell everybody.
Please.
That I try to do on a regular basis. I give control to the divine who created me. I feel like the minute I have lost control, and it's very hard to do at times. So I practice regularly to accept, maybe acceptance and submission. Submission to the gift of the pain.
Yes.
Submission to the gift of challenges. I really learned to say, okay, I'm glad it may be the whole, like you and I started this today. You said, I was apologizing for being, we had discrepancy and we couldn't be together.
Yes.
But you said the exact same thing. I believe things happen for a purpose and a reason. When I started learning that is not me anymore, I do my very best. I do everything I best. I study a lot. I do my best. But I tap a lot into this. I tap into the inner peace.
Yes.
And I really get from the divine power.
And I think I just want the audience to be clear about this, because I truly believe in what you're saying. Submission or surrender does not mean inaction. It doesn't mean that you're just sitting on your couch and you've submitted and that's it. You are still taking action in the belief that the next step will be shown to you. What are you going to do next? It will be revealed to you. So I totally agree.
Can I just tell you one thing about this?
Please.
There's something very important. I know we're about ready to finish, but recently, just very recently,
yes,
just after you and I met, I discovered that I have severe mitral valve prolapse and severe mitral regurg. I became very incapacitated for almost 3 months. And I've never told, and I want people to know that. And I had the choice to really give up everything, not being on your show, and to be a walking dead, or to really live beyond my legacy until the very last day. Now, I may do surgery, I may not. I've done a lot of changes in my lifestyle to really see if I can really reverse a lot of mitral valve regurg is very hard to really reverse. But I was trying to see if whatever I do, from peptide to exosomes, whatever I do, and would help me or not, get my inflammation down and all. But at the same time, I decided, no, Dalal, you're not a walking dead. You're here to finish, to go to the finish line. And I would not be a walking dead. So I chose, that's a choice I made. Or I wouldn't be even with you today. I would have been in my room crying and upset and worried and saying, okay, I may have sudden death. But I know we all, so I didn't get upset. I didn't get angry. I accepted the plan. It's a divine plan, and it may be the best thing that ever happened. Now I have a new story.
Oh, I salute to you, for that amazing act of courage. I remember you were not very well. That's the only message that I got about 4, 5 weeks ago, whenever it was. And
Yeah.
I was just sending you prayers and wishes that, hope you get better and all of that. So that's fantastic, Dr. Dalal. So my second question, and these are the three questions that I ask all my sort of guests who I invite on this show, is that if, say, all your work was taken away, all the books that you've written, amazing talks and interviews and everything, the beautiful medical center that you've created, if everything was taken away from you, and we said, or the universe said, just give us 3 pieces of wisdom that you can give to your kids, your grandkids, or your loved ones, whoever it may be, what would those 3 pieces of wisdom be?
Be true to yourself.
Okay.
Never, ever give up. You're unstoppable if you have a mission bigger than you. Love yourself and forgive everybody. Forgive and love,
Yeah.
really. The wisdom is forgiveness. The wisdom is to really make peace with yourself first.
Yeah.
I did not understand that the reason I've never hated people, I thought it was because I'm a kind person. Now I'm thinking that's because I'm an egoistic person. I didn't know. When you love, you can't hate. When you cannot hate, you become disease-free. Because I can sleep at night when I don't hate.
Yeah.
So I love everyone, whether they hurt me or didn't. So love and forgiveness is incredible.
Yeah, and
So
it's very hard for people to forgive, actually, Dr. Dalal. Like I'm sure you see this in your practice, and I see this in my practice when I meet people, even day to day in any walk of life. They are used to complaining. They are used to complaining about people and just bitching or whatever word you want to use. I think it's very hard to forgive, isn't it?
when I tell my cancer patients, I tell a lot of my patients, whether they have chronic disease or cancer, well, you either come to peace with it and forgive those people. You don't have to forget what happened. Make peace with them. Bring
Yeah.
them to you, whether they're dead or not. Just talk to them
Yes.
and make peace with them. Cut the cord so you don't really continue to be a victim of that. Otherwise, you're never going to get better. Don't waste your money and time with me.
Yeah, that's so honest, for you to be so true to because sometimes these people, then they need to hear this. They haven't heard this ever. They think it's a normal state of being because that's what they're surrounded by. So that's fantastic. And the third question I have for you, Dr. Dalal, is what do you see as your legacy? How would the world remember that Dr. Dalal was here? So, what is your vision? What are you wanting to leave as a legacy?
I really want to leave beyond my legacy. And I feel like it's beyond legacy for me. I want to be able to see that one day that the treatment that I have been able to get, and it really have to do with mastery. If people start listening to patients again, and if they change the way they really treat patients as numbers, and patients are lived with love and kindness, if I can change people from really being too in a hurry when they see their patients, when I change the system where people are pro-treatment anymore, if I feel like I can make people feel better and learn that cancer is choice, we make a choice to have cancer, and if we don't want it, we can prevent it, is 90% preventable.
Yes.
If I can make that influence, I would feel great. And I believe that God is helping me a whole lot to meet people like you, where I can get my word amplified. I can show people pictures of what happened to other people in my life. It's beyond my legacy to really see that cancer is preventable. And the other thing is to help men and women to know, if I could do it, why can't you?
Yeah.
I want to be
Yeah.
an inspirational woman for every person. I
Yeah.
don't want to be inspirational woman for women. I don't know why. I've never been biased by women. I love my women. They're wonderful. Without them, I think they've suffered a lot. I understand everything about inequality, but I really don't like to dwell on it.
Yeah.
It's just I want to see men and women feel like we are one.
Yeah.
together, and we can change life. And yes, but you have to work hard at it. I mean, but anything that's worth anything is you have to work for it.
I love your energy, Dr. Dalal, and I love how you say that, what you're saying is what you focus on really expands. Shift your
Right.
focus off the negative things that you are dwelling on. Come from a place of gratitude for what you've been blessed with and focus on what you really want. So that's really fascinating, Dr. Dalal. I commend you firstly. I want to acknowledge you for the amazing work that you're doing. You're inspiring so many people and you're touching humans. I say that if on my life journey, if I could even make a difference in one person's life, I would think that my life was successful. So I think, that's really something that I see as a kinship with you and so much to learn from your wisdom and to develop on that. So I want to thank you for your time today. I truly appreciate, and I feel this interview, this conversation will allow people to dig a bit deeper and explore what really is the basis of disease and how to unlock their own health and well-being. Although it's just a tip of an iceberg, but it is a starting point of this journey. So
I love what you said. It's a beautiful starting point. Thank you so much for the interview. You have an incredible energy as well. I think, you feel my energy because you have the same energy. I think there is synergy and there is the divine need for us to be together and amplify our voice. So I'm really grateful to be part of your team or your family, and together we can have a bigger voice and a larger voice and touch more people.
thank you so much, Dr. Dalal.